A to the B to the G. We're gonna be talking about ABGs right now.
That bounce right here.
If you please. For real.
Time to move on. Time to be strong. Don't stop now, straight to the top now. That's what I need.
G's. What the heck are ABGs? Really just stand for arterial blood gas. And ABGs just interpret two things. Is your body acidotic or is your body basic? Or in other words, alkalosis. And where is it basic or acidotic? If you guys remember your pathophysiology days, that your body really runs on a basic or acidotic teeter-totter, I like to say. So based off our teeter-totter here, it's either going to be respiratory, acid, or base, or metabolic, acid, or base. Okay? This stems from your lungs or your kidneys. Now, easy ways to remember this. For your respiratory tract here, if you have too much carbon dioxide, I like to call it carbon diacid, you'll be in an acidotic state. If you have acidotic state. If you have too little carbon dioxide, and you have an increase in oxygen, you'll be in a basic state. With your kidneys, if you have an increase in acid here, or basically if you get rid of all of your base, if you get rid of all your base in your body, you're going to be in an acidotic state. With your kidneys as well, if you get rid of all of your acid, you'll be in a basic state. So here's a simple way that I like to remember it. When someone's sleeping, when you go to sleep, you're breathing very slowly, right? And you have hypoventilations. So you're breathing slow, and what does someone sound like when they're breathing slow? If you ever heard someone sleeping, they go, right? So I like to remember that as acidotic. Acidotic, okay? Because you're keeping in all of that carbon dioxide. You're not breathing it out. You're keeping it inside your lungs, and that's what makes your body acid, or your lungs acid. Okay? On the other hand, if you're hyperventilating, remember your ventilation's between 12 and 20. If you're breathing way too much, and you're having an anxiety attack, and you're like, but there's a robber, and he's chasing me, and right? It sounds like alkalosis. You're breathing off all that carbon dioxide, and your body becomes acidotic. Your body becomes alkalinic. You're breathing off all that acid, alk, and you're making your lungs alkalosis in a basic state. So it's acidotic if you're keeping in that carbon dioxide. It's alkalosis if you're breathing out all of that carbon dioxide. You're getting it out of your body, getting all that acid out of your lungs, and making your respiratory tract basic. So that's why the doctor will give the patient with an anxiety attack a paper bag to breathe into. Right? And that bag inflates and that bag decreases. And you have a paper bag. That just makes sure that we're getting in all of our acid that we're breathing out. And to bring your respiratory rate down. Now, what about your metabolic here? Your metabolic. Where is all of your base stored in your body? It's in the lower GI tract. Okay? So if you get rid of all that base in the body through diarrhea, and your body will be acidotic, because the only thing left now is the acid inside your stomach, and that teeter-totter now gets shifted to an acid portion here. So we got rid of that base. We only have acid in our GI tract now, so we'll have a metabolic acidosis. Easy way I like to remember this is if you have too much diarrhea out of your acidosis, you're going to be acidotic because you're making your body acidotic. So you have too much stuff coming out of your acidotic, you're going to be acidotic. On the other end, if you're throwing up all of your acid, your body's going to be basic, okay? So I like to call that alkalosis, because you're getting rid of all of that acid. You're going alkalosis, okay? Alkalosis. So just remember that it's a pH balance between base and acid. Carbon dioxide for the lungs. Is the acid high or is the acid low? And with your metabolic, are you getting rid of all your acid? Or are you getting rid of all your acid? Or are you getting rid of all of your base? So let's go into exactly how to set up your ABGs to make sure you never ever miss another ABG question again on any of your tests. And I'll even throw in some scenarios right now. So let's do it. So I want you guys to understand and really hone in on ABGs by utilizing this marching band uniform method that I promote. So I just call it a marching band uniform here. Marching band. We can just call it a marching band suit. So before you tackle ABGs and before you try to understand ABGs and get confused, I want you guys to write this out on every test that you take before you try to tackle the ABG itself, okay? So I want you guys to write out this little marching band uniform, I call it. It looks kind of like this. You put your pH balance up here, okay? You put your PCO2 up here. Then you put your kidneys here, your HCO3. All right? Then, kind of looks like a marching band uniform, right? Then you write out ABA. I say ABA. Then you write out BAB. BAB, okay? ABA and BAB. So once you got this figured out, your pH on top, your lungs over your kidneys, and you write out ABA and BAB, now we're ready to tackle the numbers itself. So let's tackle the numbers right now. Alright guys, so once you have filled out your marching band suit of your ABGs, okay? The little buttons on your marching band suit. You've put your pH up here, your lungs over your kidneys down here. Now you're ready to type in the numbers. And remember, ABA, ABA, and BAB, BAB. ABA and BAB. Now let's put in the numbers, and then we'll make sense of all this, okay? So your numbers are 7.35 to 7.45. When you drop it down, you drop the 7. So now you have 3.5 and 4.5. When it comes to your kidneys, your HCO3 or your PCO3, you do a 22 to 26. Okay? Now you're ready to kind of interpret the ABG. So your pH up top, this acts as your key, okay? So this is really your key to interpreting your ABG. So is your patient respiratory alkalotic or respiratory acidotic? Is your patient metabolic acidosis, metabolic alkalosis? Your key will help you match up if they are. So let's say that your pH acid is somewhere between less than 7.35. The question on the NCLEX or whatever will say, hey, you have a pH of 7.25, less than our acid. So we're already thinking acid. Now we just have to match up an acid on our respiratory, it'll be respiratory acidotic, or an acid on our PCO3 or our HCO3, and that'll be metabolic acidosis, okay? On the other end of it, if we have a 7.45 and above, it'll be basic alkalosis. So we just have to match up for respiratory alkalosis or metabolic alkalosis. But really, guys, our key up here, if we have a match down below, will help you to understand and really pinpoint, is it alkalosis or is it acidotic? Is it base or is it acidotic? Okay? So, let's give ourselves a run through. Let's do a little scenario. Your patient comes in for, let's say, hyperventilating. You have a anxiety patient who is not taking their benzodiazepines, and they just had a traumatic event. Let's say they had a car accident, and now they are hyperventilating, and they're becoming very anxious, and they're going, right, like a dog, kind of. Their pH is going to be, well, it should be, they're blowing off all their carbon diacid, okay? They're blowing it off. Their pH should be alkalosis, because they're going, right? Alk. So their pH should be somewhere over here. Let's just call it 7.55, okay? Anything greater than 7.45. Now, since they're breathing off all their carbon diacid and they're retaining all their oxygen, they should be somewhere in the alkalosis state because they're hyperventilating. Alkalosis, basic. So they're basic, they should be somewhere less than 3.5. For demonstration purposes, let's just call it 22. Okay? And since their kidneys and their metabolic is not really involved right here, we'll just put it somewhere in the middle. Usually the kidneys will try to compensate since the body's so basic right now. The kidneys are going to try to bring it back to normal because we want homeostasis. We want to stay the same. We don't want to be too basic. We don't want to be too acidic. So sometimes the kidneys will be right over here trying to make the body a little more acid. So if you get a question like this, you match up your alkalosis, your base, from your key down below. If you have a match, then you say it's respiratory or it's metabolic, alkalosis or acidosis. So, for our critical thinking question here, your patient comes in with blowing off too much carbon diacid. There's no more acid in the lungs anymore. You have oxygen. You have a basic state. So their pH is going to be somewhere in the basic area. Their respiratory tract, they're blowing off all their carbon diacid. Carbon dioxide. Hopefully you guys are following me here. But carbon diacid, I like to call it, just to help me remember. So they're going to be basic, guys. Because now they're blowing off all their carbon dioxide, keeping it basic. And they're going to be respiratory alkalosis. Because they're going alkalosis, okay? A little way that I like to remember it. On the other end of things, guys, what if you come with a patient who has respiratory depression? They're not breathing right. They're breathing too slow. They're keeping all that carbon dioxide, in their lungs. Do you think the patient is going to be basic or acid? It's very, very simple, guys. Carbon dioxide, if they're keeping all that CO2 in their lungs because they're breathing slowly, right? Have you ever heard someone breathe slowly or breathe in their sleep? It kind of sounds like a hissing sound, right? Right? When you're sleeping. Right? So, I like to remember that as acidosis. Acidotic. Okay? Now, I know I'm making a fool of myself, but if you guys learn, that's all I care about. So, you're breathing in acidosis. Okay? So, with respiratory depression, you're going to have an acidotic state because you're keeping in all of that carbon dioxide, all that carbon dioxide. So how does your ABGs look? If you guys have an NCLEX question, and that NCLEX question says, what do you expect your patient to look like? How do you expect their ABG to look like if they're having respiratory failure? Or if they're not breathing enough? You know, their respiratory rate is less than 12 to 20. You're going to have probably an acidotic state. So your pH is going to be less than 7.35. Right here in this area. So let's say it's 7.30. Now we just have to match up that acid with one down below. Is it going to be respiratory or is it going to be kidneys? Okay? If it's respiratory failure, acidotic, okay? 4.5, it'll probably be somewhere greater than 4.5. And we match it up with our respiratory. But really, we have to start with the key. What does the key say first? And match it up down below. So if it's acidotic, it's going to be respiratory acidosis if we have an acidotic PCO2, that carbon dioxide, okay? Now, how do you think the kidneys are going to compensate? Remember, your body doesn't like to be too much of one thing. It likes balance. It likes homeostasis. It likes to stay the same, okay? So, your kidneys, your lungs are in an acidotic state. Your body is now in an acidotic state because of holding in all that carbon dioxide. So your kidneys are going to try to pull back, like tug of war, pull back your body into an alkalotic, a basic state, okay? So, you'll probably find your kidneys to be somewhere in this general area. Maybe even way over here, past 26, in your alkalosis area. Okay? Just because you're doing that tug of war, and you're pulling that patient, you're pulling your body back into homeostasis. That makes sense? Hopefully it does. Let's do our last two scenarios right now, okay? So we went over respiratory alkalosis, our base. Okay? We're breathing, we're hyperventilating, we're blowing off all that carbon dioxide, okay? We're making our body more basic. So we're going to have a basic lung. Acidosis. What makes our body acidic? What makes our lungs acidic? We're keeping in all that carbon dioxide. Hypoventilation. Respiratory failure, not breathing enough. Keeping in all that carbon dioxide. Now, what about our kidneys? What about the metabolic, right? What if our lungs are not involved at all. How will the ABGs interpret this? So I like to think of it like this. If you are alkalosis, you're getting rid of what? If your body is going to be basic or have a base state, you're getting rid of what? You're getting rid of all the acid of your body. Now, where does the acid reside in terms of your metabolic? In your stomach. That's why a lot of us get heartburn when our stomach acids, come up and start burning our esophageal tract. It's called GERD. So, if we get rid of all of our acid from our stomach, that's what makes us alkalotic, basic. So, easy way to remember this is if you're vomiting or have a vomiting patient, you can just remember it's right? Alkalosis. Alkalosis. Okay? Alkalosis. So your ABGs are going to be somewhere in the alkalosis state here. So above 26 for your metabolic. Your key now is only going to confirm if the patient is in an alkalosis metabolic state. Whoa. And it's only confirmed if it's above 7.45. So it'll be above 7.45. That's if we're doing alkalosis and we're vomiting all of our acid out of our body. Guys, remember, please remember, use your key first and then match it up down below. So our last scenario, guys, our last scenario here is all about acidosis. How do you know if your patient is in a metabolic acidosis state? Their body's holding on to all the acid, right? So what are we getting rid of? We're getting rid of all of our base. Now, where does the base reside? The basic, in terms of our metabolic, resides in our GI tract. Usually our intestines and our colon. It has all of those basic enzymes that break down and metabolize and help us absorb food. So, if we have diarrhea, and if we are in an acidotic state, you are using your acidosis, right? You have more fluid coming out of your acidosis. So you can remember it like that. You're getting rid of all of your base out of your acidosis. So your body becomes acidotic. So if the NCLEX, or your next test question, talks about your patient comes in with, 2 days of severe diarrhea. Maybe they're going 3 to 4 times of diarrhea a day. You already know that your potassium is going to be low. You already know that you're going to probably screen for C. diff because there's probably bacteria going on in the lower GI tracts. Probably going to get flagyl or start the patient on some type of antibiotic. But what is their ABG going to look like? They're getting rid of all their base out of their acidotic, right? So they're going to be acidotic. But you have to first match it up with your key, remember? So your pH is going to be less than 3.5, somewhere over here in this area. And it's only confirmed if your HCO3 or your PCO3 is less than 22. Usually probably 19, 18, somewhere around there. Then you match it up, check for our key. We're checking down below if there's an acid. And if it is, we are metabolic acidosis because of all that base coming out of our acidosis, okay? So guys, remember it like that. Hyperventilation. You're blowing off all your carbon dioxide out of your lungs. You become basic. You're keeping all that carbon dioxide in hypoventilation. You become respiratory acidosis, okay? With your metabolic, If you're and throwing up all of your acid, you're going to be alkalosis. You're going to be metabolic alkalosis. Okay? If you are coming out the other end and you're getting rid of all your base out of your acidosis, your body's going to be metabolic acidotic because you're getting rid of it out of your acidotic. So there's your ABGs in really a nutshell. Hopefully that helps, guys. I have way more content for you, all for free, at simplenursing.com. You can pick up your 3-page report all about ABGs at simplenursing.com. Hope this helps, guys.
It's that bounce right here. Time to move on. Time to be strong. Don't stop now, straight to the top now. That's what I need. Come on, that's for you, baby. Girl, you made me believe again. If you happy,